What's actually safe to eat right now? And what happens when we gut the public health agencies whose job is to catch foodborne parasites before they reach your plate? Dr. Janet Krommes from Doctors for America breaks down two outbreaks hitting America's food supply: the Cyclospora outbreak linked to lettuce and the new Salmonella outbreak linked to jalapeños, and the bigger story behind them. Welcome to Care Talk Live, a weekly American healthcare policy show and podcast where we explain how healthcare works or doesn't work and get you answers. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get future Care Talk shows. So, what does safe to eat really mean when our food safety net has holes in it? Dr. Janet Krommes is a retired rheumatologist and the chair of Doctors for America's FDA task force. Welcome.
Thank you so much for inviting me to talk on Care Talk. I mean, you go beyond the headlines, and this is one of those subjects where that is so incredibly important. We've heard a lot about Cyclospora, but do we really understand it? And do we understand how to protect ourselves? And more importantly, what should we be demanding of our government to fix this? So this is the ideal location, and I'm really happy to be here.
Thanks. So this was top of my mind when I was getting groceries just the other day. So tell us the latest on the Cyclospora lettuce outbreak.
Well, there's the outbreak that we all know and love, the one that was huge, had the epicenter in Michigan, is probably over. But there are certain characteristics of the cyclospora itself which make it very hard to be definitive about that. And the reason for that is with most enteric pathogens, we have norovirus, we have many bacteria, and with the bacteria, we can identify the family they're from, the subtype. And when those match, we know, it looks like this was one outbreak. But with cyclospora, we can't do that at all. There's no genomic testing for cyclospora. And so this is happening in so many different spots. And because summer is such a high risk time for cyclospora, it's impossible to know if we're truly out of the woods. And I would say that because it's the system itself, that is not tracking things well enough. It's not preventing food outbreaks. And that makes it hard to say that we're out of the woods. It's a difficult organism. There was research that was ongoing that has stopped as it pertains particularly to cyclospora. We're not mandating tracking through FoodNet. So there are a lot of reasons to still be concerned that whatever conditions led to this outbreak, at least the one that we're aware of, could result in further outbreaks. We're still in that time of the year where those things are possible. And so one way to look at this is to break things down into person risk levels. A lot of times the FDA looks at risk levels of produce, but as people, we have to think of our own risks and decide how seriously to take this. Do we avoid lettuce altogether? Or is it okay? Do we have a tolerance for getting a little bit sick and remembering that most people are asymptomatic and most people in that healthy adult phase are, going to do just fine. But if we've got children under 5 in our family, if we have adults greater than 65, if we have immunocompromised people, and as a rheumatologist, of course, that's always top of my mind because there's autoimmune disease. There's the drugs we use to treat autoimmune disease. People with cancer, even past history, are at greater risk because of all of the things that happen to the immune system in our treatment of those diseases. They're really, difficult processes to go through, and they leave a mark behind. And so that vulnerability should be taken into account. But most of all, the message for pregnant women is even stronger because most pregnant women are in that healthy adult phase, but the differential effect on a baby is very different. So listeria, for instance, is something we really worry about because it can result in stillbirth or a miscarriage. And so if I were pregnant, I would change the way that I was eating in a very different way than I would if I was a healthy young adult. So I think that's the first thing to consider.
Mm-hmm.
in terms of Cyclospora, it's a great example of why the unique characteristics make this so prone. And, there are some mystery questions here. Last year there were 4,000 cases that we could pick up. This year we're in the 24,000 plus range. What was the difference between last year and this year? Was it all just that one plant? There's no real person to person contagious aspect to Cyclospora. So this was coming from contaminated wastewater that was used to either treat the machines that processed the produce or to irrigate the fields, one or the other. But it's hard to find because the oocytes themselves, which are, think of as a time in their life cycle where they've got a very hard shell. So you can use sodium hypochlorite, which is bleach, doesn't kill them. If your machinery is contaminated, washing them with hypochlorite will not work either. So once you've got that contamination, it's very difficult to eradicate. The only thing that's going to kill Cyclospora is heat. You really have to get up to a temperature of 158 degrees. So with Cyclospora, it's a case of we don't have really good testing for it. That's something that a program called FERN was working on. That's the Food Emergency Response Network. That's part of CDC. And one of the projects they were working on was a good test for Cyclospora on spinach. That program got shut down during Doge. So, it's an area that needs research. We need improvement. The organization is still there. It's sort of a shell organization. No research is happening. In retrospect, of course, that's incredibly important. The cutbacks at the CDC in terms of personnel always affect state health people too. So the resources are not there. And so when these outbreaks do become apparent, if there's a cluster of cases and someone is bright enough to order the Cyclospora test, which is a very expensive test, it's not something you're going to order for every case of diarrhea. But once it crosses into that threshold of a signal, then the FDA will be the organization that instigates the investigation. And they coordinate that trace back part of it that has to do with the history. And it can take 2 days, 14 days for symptoms to appear. So I challenge anybody to be able to give someone a food diary. I know when I had salmonella, I was in the hospital for a few days. It was a very significant illness. I would never have been able to pinpoint where that came from. They did get that history in it, but it was only by finding intersection of other people's histories. In my mind, it was the manicotti I had right before I got sick. I still don't eat manicotti. But, so it's a challenge. And, in a short period of time, to really question 24,000 people in a very detailed way is a huge task. It's amazing. It's only the dedication of those CDC workers and the state health workers that made that happen. It wasn't the system helping them out. They didn't have the adequate resources to do that. So that's the first phase. You get the signal, you get the trace back, you get an idea of, what the source is, but then the FDA comes in again and they look at the supply chain. And that was very hampered in this particular outbreak. They identified Taco Bell as the probable source, but it still took almost 2 weeks to get supply chain information from Taco Bell. And is it necessarily Taco Bell's fault? Well, this is where Congress comes in, because there was a wonderful bill passed in 2011 called the Food Safety Modernization Act, and it was revolutionary. It was taking the FDA food safety program from just reacting, from just checking out outbreaks, looking for a root cause of the outbreak after it's happened, and it shifted everything to prevention. And then it also added components to, if there was an outbreak, to get back very quickly to the source so that could be investigated. And that's what the traceability rule was meant to do. So it was not one of the first things that was going to be implemented, but the original target date, of 2023 blew past. And then it was Congress who actually put it into law that the FDA cannot ask for traceability until 2028. And so that's an incredible tool that you would think that with our ability to automate and use computers, we should have at our fingertips so that we could immediately figure out where this outbreak was coming from. In the case of bacteria, we could very easily use that trace bat to be sure that we're treating everything. Cyclospora, again, is a little different because we can't do genomic testing, but, we would still make things much faster. And we could find out where this produce was distributed and get those recall issues out fast. So it's just a combination of problems, but I would say the fixable part, the really fixable part, is the government, and in particular the FDA.
So, for all the people listening and watching right now that are unsure of what produce is safe to eat, do you have any thoughts or tips for when somebody's going grocery shopping?
Yeah, well, there are some things that are way more dangerous than others. So, and in fact, the FDA is finally coming up with a guidance on how to treat, from the time that you plant until it gets to your table, what they call the ready to eat high risk elements. And so those are things with a very high water content. And we know that water content plus temperature, which is why the summer is such a deadly time, will allow for bacteria to grow. So you may have a very small amount of bacteria to start with. You cut that lettuce or you cut any surface of the produce, and you suddenly create an even better environment for bacteria to grow. So they're focusing on things like melons, which are very low acid fruits. And so that's conducive to the growth of enteric pathogens. And we say enteric pathogens, that's the whole gamut, right? It's norovirus, the virus, it's the bacteria, Salmonella, Shigella, Campylobacter, Yersinia, Listeria, that whole family of bugs that can make you sick, and Cyclospora, which is a protozoa and not a bacteria. So all of those things can be contaminated, and the risk is much greater in the summertime. They're much greater if they've been sitting around for longer. They're much greater if there's been problems with refrigeration. So think about, you're driving a produce truck and you've got a load of spinach in your back and it's 110 degrees and you're driving through Texas. And, what if your refrigeration is not quite up to the job? Maybe it can handle 90 degrees or 95 degrees, but when it gets to 110, the temperature's rising in the back of the truck. And then when you deliver it to the grocery store or wherever the final destination is, you've got more bacteria growing. So in times of great heat, you've got to take that into consideration. Maybe that's a time to stay away from those high water content, ready to eat things that you're not cooking. If it's in a cooler part of the year, it may depend then on your own risk. Are you at high risk? Are you pregnant? Then I would probably avoid them. So melons, shredded lettuce, bag salad, spinach, kale, cabbage, and raw sprouts, which love moisture and love to be in a warm environment. Those are all super conducive to the explosion in population of these enteric pathogens that can make us sick. Other things to think about, pests, when we get it to the grocery store and we get it home, or maybe we've gone out to eat, cooked starches are also problematic. So rice and pasta, if they're out for an hour or more, they allow for the growth of an organism called Bacillus cereus. And so if you think, well, gosh, you were at a restaurant and you take home rice after a meal, but it was sitting out while you were enjoying your meal, it's out while you're driving home. Even if you get it in the refrigerator, the potential for that to have a lot of bacteria is high. And cooking is not going to kill it. It's a preformed toxin that'll make you sick almost immediately. So again, I would think about that any time of the year, but especially if you're eating out in an outside restaurant and it's warm, and then it's warm in your car, it's going to be more dangerous. Of course, unpasteurized milk and milk products can have a lot of bacteria. And even though the federal law says you can't take them across state lines, you can still obtain them. And then we don't always think of soft cheeses that are made from unpasteurized milk as being dangerous, but they can certainly carry listeria bovine tuberculosis, Campylobacter, E. coli, all those things are things you worry about. Another thing, not just at the grocery store, but there are things that are buffet lovers. So the two organisms that love buffets are Clostridium perfringens and Staph aureus. And with those organisms, you're going to get a preformed toxin. They're happily reproducing on a steam table if there's a lot of meat or gravies. And then when you eat them, it's the preformed toxin that makes you very ill. So those are problematic. And then one other thing that's really worth mentioning is, again, with that connection with pregnant women and listeria, it's soft cheeses because listeria grows at refrigerator temperatures. So even when we do everything right, if we take that home and you cut that, and if you've ever noticed that funny little color to soft cheeses, if you've forgotten about them in your cheese drawer, that can really make people sick. So we're surrounded by risks, but a common sense approach can be really helpful.
And that's helpful for people on an individual basis. But what would you say we can do about the larger problem, which is, as you mentioned, these public health agencies have been gutted, the people that are looking to make food safe for everyone?
Yeah, well, there's two parts of that question. One is what has happened since the Trump administration came into power. And that's been a considerable effect on food safety, and primarily by destabilizing and creating chaos at the FDA. So even though the food inspection program was not touched by DOJ itself, they did get rid of the people who arranged the travel. So traveling to a foreign country sounds lovely until you're going to the places those food inspectors go, and they can be in dangerous places. And so it requires coordination, for instance, with the Mexican government. If you're going to an area that is controlled by cartels, but that food product produce is coming to the United States, as an inspector, you want to be there, but it's a dangerous situation. So the experts that arranged those travel plans were all let go in DOJ, as were the reimbursement specialists. And at the same time, there was a rule that you couldn't use your federal credit card. So the food inspectors who were still there, and they numbered about 435, and just to put that into context, the goal number for food inspectors that's in the Food Safety Modernization Act from 2011 is 5,000 inspectors. So they're already down to 435 people with the expertise to carry this out. And they suddenly didn't have the wherewithal, they didn't have the infrastructure to do that. So that is clearly something that needs to be addressed. It's been very hard, even for Congress members, to get information from the FDA. But hard doesn't mean impossible, and it doesn't mean that we shouldn't get it. Because if you're talking about prevention, which is really what we want, I mean, it's very nice to track an outbreak. I'd rather not get sick at all. I'd rather think that my food is safe. So prevention is where it's at, and that requires food inspectors. But as I said, we're in that 400 range. And so why was that? I mean, we're talking about a law that was passed in 2011. Why didn't that ramp up the way that it should? Why didn't the number of inspections ramp up the way that was planned? And that was set at every 2 years. If you're a high risk producer, you get an inspection. If you're non-high risk, it's every 5 years. And that sometimes the FDA would subcontract out. But there are 300,000 facilities that need to be inspected, and more than half are overseas. So it's an enormous effort. And the law passed, but Congress never appropriated the money to pay people to do it. And it never happened. And then we had the government shutdown in 2018. And because those workers aren't protected, only emergency workers can work during a government shutdown, and food inspectors were not considered to be in that group. So in 2018, we had a prolonged government shutdown. The next time that happens, the food inspection people should be considered emergency people. I mean, it affects our safety. And that is crazy because they end up getting back pay anyway. I mean, it's just, sort of blows your mind how they can't be pragmatic about this. And then the next thing is, so they rehired people to do the travel and the reimbursement, but now they're centralized. So you've got a group of people doing this who don't have the expertise in these difficult situations where you're getting visas to go to places where people, would rather not have inspected. Um, and so that just hasn't translated into safety. And in fact, it's degraded our food safety. So the programs that were shut down, we know FoodNet, which is the active surveillance, they are picking up signals all the time. So when labs would get a positive test, some thoughtful person somewhere orders a test with someone with diarrhea and wants to know what is going on. And if that laboratory test is positive, the information was supposed to go back centrally. And if the FoodNet, which is run primarily by the CDC, but also the FDA and the USDA through the Food Safety Network that they have, when they would get a signal, that would trigger them to start looking. So if you've got 5 people in Newport, Rhode Island who suddenly get positive salmonella tests, you got to look at that. The way that the system is now, we've cut back on the number of organisms to just 2. And so Cyclospora was one of the ones cut out in July of 2025. And at that time, people were saying, this seems, we're seeing more and more Cyclospora every year. How much sense does it make to drop this? And although the government, if you ask the FDA, was that an okay thing? Their explanation is, well, it really wasn't helping us detect outbreaks. But it's a system that could. It's a system that could be expanded. And I think many food safety experts would disagree with that characterization, that, it was a great system that should have been expanded to include all 50 states instead of just the 10 that are in the program. But it was a tool that's analogous to what we use in checking drug safety, and that's been expanded over time. So we have the ability to do it. It's a question of, does someone think it's important enough? Does Congress and the government think that people will make a fuss if they don't do this? And that's where you come in with this show, because if we make a fuss, it's a lot more likely to be solved. And so it's critical, absolutely critical. So that program was cut back. There's a program called CORE at the FDA that also still exists on paper. It just doesn't exist in action. And so they were the coordinated response and evaluation team. And that evaluation part is really expensive and really important, because what they were supposed to do is they'd have an outbreak and then they'd start to figure out, well, what are the systemic causes? What are we not addressing that we should address that the next time we should address? That would seem pretty darn fundamental and logical. So, has the Trump administration impacted or degraded our food safety net? Absolutely, it has. Is it putting us at risk for more problems in the future? It absolutely is, because it's much harder to recruit people to be FDA inspectors now. It's a tough job. It takes 2 years of training. It takes many years for a level of expertise that really translates into someone being able to walk into a situation and say, I have seen that before, and I know that's a problem. So if we don't have those people, they don't have job security, they're forced to work in Bethesda. And if you've ever been there, it's hard to get to that place. There's no real mass transit. And the traffic is terrible, and it's expensive to live there. And so all those things make it really, why would you work there? Right? What is the attraction other than your sense of civic duty, which I think, they have in spades. Those people are really dedicated, but they're just not getting the support. And that is going to tumble through the years. It's going to accelerate. It's very hard. And they have an outside contractor who tells the FDA, this is what you're doing wrong in terms of hiring and retention, but they're not listening to those people. And the FDA itself is not allowed to say that they're under capacity. So it's going to be a big problem in the future to rebuild.
Absolutely. And so, for everyone listening, that's your cue to contact your congressperson, because Congress has the ability to appropriate more money to fund people to do this work and to do something about the cutbacks. So, thank you again for joining us. And hopefully, people will take your words to heart and have a healthier, safer food summer. Thanks.
Thank you so much.
And just a reminder that we have free or low-cost healthcare resources available on our website at healthcarevoices.org/caretalk. So check it out. And please text or call in your health insurance and healthcare questions at 202-838-6837, and we'll answer them in future episodes. And now our experts will answer your health insurance questions. So welcome to Diane Archer, the founder and president of Just Care. So Diane, tell us about the hot healthcare topic of the moment, which is prior authorization.
Prior authorization is the hot healthcare topic. And much like what's going on in the food world, not very much is going on to protect people against insurers who are delaying and denying care inappropriately as a result of their too often indiscriminate use of prior authorization. So little has been done by Congress, little has been done by the Trump administration or the Biden administration to improve the situation for people, particularly people with costly conditions who literally can become sicker and even sometimes die as a result of the misuse of prior authorization by the insurers. The one thing that has been done, though, is that during the Biden administration, a new rule was passed requiring insurers to disclose some data related to their use of prior authorization. And what the data show just confirms what we have been hearing and reading about all the time, which is that there are very high uses of prior authorization by the insurers to deny care inappropriately. And the data applies to Medicare Advantage, to insurance through the state health insurance exchanges, and to Medicaid managed care. So what it is showing is, I think it's 1 in 8 requests for care in Medicare Advantage are being denied. And it's even higher in the state health insurance exchanges. I think it's 1 in 6 requests for care are being denied. But what the data also show is that people who appeal more than half the time, and sometimes as much as 80% of the time, see that they can get care once they've appealed. It's successful. The insurers overturn their denials and people finally get access to care. The problem is that most people don't know they can appeal, or they feel that it's too burdensome and don't go through with it. And the message, I guess, the big takeaway of the day is that if you are denied care by your insurance, be it Medicare Advantage or Medicaid, managed care, or insurance through the state health insurance exchanges, you can appeal. It's easy. You just simply request it. You don't need a lawyer. It's free. And you have a high likelihood of prevailing. It helps, especially when you have your doctor on your side explaining why the care that you've requested is medically necessary. That's what people have to do, unfortunately, at the moment, until Congress or the administration steps in and restricts the insurers from using prior authorization in the ways that they currently are. And of course, everybody should be aware that it's in the insurer's financial interest to use prior authorization to deny care, because for every claim that they deny, every service they deny, it's more money in their pockets.
Absolutely. And we'll talk more about this next week. So thank you, Diane.
Excellent.
And thank you, everyone, for joining us to learn more about healthcare policy, patient rights, the fight for a just healthcare system, and answers to your questions on health insurance and healthcare. Be sure to check out more free or low-cost healthcare resources on our website at healthcarevoices.org/caretalk. And please text or call in your health insurance and healthcare questions at 202 838-6837, and we'll answer them in future episodes. Join us next week for more. And be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.